but there are several other kinds of crooked toes that can occur. Another very popular kind of crooked toe is for the second joint in the toe to become deformed in the flexion position, and that's known as a mallet toe. And so what that toe will look like is not like a hammer toe, which is this, but that toe will look like this. Furthermore, it's possible for the flexor tendon on the bottom of a person's toe to deform both of those joints and to get what's known as a claw toe, where both at the proximal interphalangeal joint and at the distal interphalangeal joint, that toe is in a flexed position. Traditionally, many times surgery is recommended for that. The only time I recommend surgery for that is if that individual can no longer reapproximate a straight great toe. If they can take their crooked toe and with their own fingers, if they can manually reduce it into a straight position, that individual many times can have a good success with a correct toes silicone toe separator. Especially if they couple that with a metatarsal pad, you can see that that will put this individual's toes into a perfectly straight position. In the individual who still has flexibility in their foot, we encourage them to begin this process. Unfortunately, the only downside of the process is that it's a long, time-consuming process. It can actually take many years to reapproximate a crooked toe. Overlapping toe, however, tends to get deformed in the transverse plane as well. In other words, it's not just in the sagittal plane. An overlapping toe, which I actually experienced myself, was when my second toe literally sat on top of my great toe. Another very popular type of overlapping crooked toe is the fifth. Will sometimes creep up on top of the fourth. Again, those two types of crooked toes, if they are reducible and flexible, can be remedied with the use of a silicone toe separator.
I love running. I love running. I love running. I love running.